So I've started you as an awareness of the ease and bind with the skin. So there's a couple of others assessments that are helpful. One is called drag palpation, and it's easier to teach that one-on-one when you guys are practicing, but we can play with the idea right now. You're going to use your fingertips, and our arm will be our client. So what you're doing is you're slowly, but not, you know, like a snail, you're gliding over the top of the skin. That's the technique. All right, now when you're doing that and you find an area that's a little sticky or a little bit more bumpy, that is an indication that there's something going on in that area. So,
describe sticky.
Sticky, I'm going to have you do something so you can feel sticky.
Okay. If you think that there was a damp spot, so that if you were to put a little water in your skin, like
So,
dry partially, and then it graze across, you feel that little damp spot.
Luke, if you can get some of the toilet paper, little damp, so that they can use that. I can feel it. Don't pee on it. Just get it.
Okay, wait a minute.
So I can feel it over where my watch was at. So if I'm, and you gotta trust yourself on it. So if
I think I have a better.
what are you doing?
I'm modifying your directive.
Does it work on that?
Of course.
Oh, that's gonna be a little too slippy.
Yeah, that's a little too slippy.
Yeah, just keep talking.
So you can be real simple with it. It can lick your finger, and all right. And then I always close my eyes. As you run your finger over where that wet spot was at, you'll drag on it.
Yeah.
That's the sticky.
Okay.
All right. So if somebody comes in spot specific, trigger pointy or whatever on something with that, instead of going, is this it, is this it, is that it, I will do this. It takes a little practice, and I can usually narrow right down to about where it's at. All right, so that's an assessment. All right, so that's going to tell you where would I start to focus. All right, so if I find a spot that is a little sticky right there, that I might stop on that and start the idea, okay, which way does it want to go? Which way does it not want to go? Wants to go that way, like that. And I might just hold it there. Now, sometimes people get a little weirded out when you just hold something.
Yeah. Or I get a little weirded out.
Yeah.
What are they thinking? What the heck are you doing?
So I might do a little shaking or rocking in the area. Well, I'm not good at vibration, but I might move it in and out so that there feels like there's some movement.
Incorporation and joint movement.
Yep.
Adjacent joint movement.
Usually over those tender spots or sticky spots, if you press down into it, it'll be a little tender. So if I can find a tender point when I press on it, using that as a gauge now, I can start to move first the distal joint and see if I can get a change. Some positions I move it in will make it feel like I'm pressing harder, or it'll hurt more. Others, it'll feel like it lets up and doesn't hurt as much right there. That's ease. That's that's what Lawrence Jones was doing. It's just in a local area. I don't have to press hard. I just press to the point that they've got a sensation they can monitor. And then I might move into the direct where it bothers and the indirect where it doesn't. That might be a spot that I would lift or stick a cup on. That's not our focus of our class right now. But if I lift that and then move the distal joint in a circle, I'm sliding one layer of tissue on another. So lots of applications. The drag is to find a point, a spot. That's what that's for. And the physiology on it is related to the nervous system, where it's called a facilitated segment in osteopathy, and part of that is a little bit of a sweat response. That's why it gets sticky. The other thing that'll happen to it is if you rub back and forth, it may get redder than another spot, and that's a histamine response.
On the practical side, this is why it's important to start with no or very little lotion. Otherwise, you would never feel this or find it.
Now, there's another reflex-based way of working with positional release. And I got to explain this just a little bit, and we'll do a couple exercises. The muscles of your eyes are very innervated, and they're very much tied in with your cervical proprioceptors and your inner ear vestibular mechanism, because it's what keeps us upright. It's part of the writing reflex. And in order for us to feel like we're not falling over or we're not dizzy, our eyes need to be fairly level with the horizontal plane. So you can use your eyes to trigger the nervous system positional release, or a direct or an indirect. So we're going to play with this, and then I'll show you how to incorporate it a little bit more. So what I want everybody to do is to rotate your head towards one shoulder and get a sense of the stop point where the bind is at, and then the other way. Has everybody got a identifiable limit in range of motion a little bit from one side to the other? Yeah, I see it on Faye. A little stiffer going that direction. Yeah. Okay. So the way that you look, the way your eyes move, is presetting the rest of your body to move in that direction. When you look opposite that, the neurological responses is that you're getting ready to move in total opposite direction. So if I start this, okay, I'm a little stiffer going this direction. So I'll go to the bind, and then I'll just turn my eyes that way. And that's like, so almost like a muscle energy technique where I'm tensing it. And then I stay in position. I keep my head turned into that bind, and then I look the other way. That's telling these muscles, you're going to move the other direction. You need to lengthen. All right? And then I'll go back, and this is going back and forth between that ease and bind idea, just with my eyes. If you can't remember what to do, move into the bind, move into the limit, and then just roll your eyes in great big slow circles. And then go the opposite direction. Okay, now check the range.
Sorry, I wasn't doing it.
There you go. All right. Did you feel it? Okay, do it again. Stop at the bind and do it again. Anybody else having trouble feeling it? No? Okay. So I can use my eyes. That's more of a muscle energy technique. Contract, relax, antagonist, contract, that kind of thing. We can use this for positional release. So who can identify a tender point on, in their chest or back of their neck? Do the drag palpation along through there.
See a hand?
Yeah, it's like, yeah.
Got it right there? All right. So press on it enough so that you can feel the sensation. Just enough so that you know that it's there. Okay. Once you find it, slowly move your eyes in a great big circle until you identify where it starts to let up, where you're pressing. And then keep going and find the spot where it starts to get worse again. It's worse for me right there. And then I'm gonna move to where it's easiest, right there. After a few seconds, you should feel a softening or something in there. Now we can add another layer on that. Find another spot that might be a little tender to the touch. Okay. Ooh. Ow. Okay, so we're going to bring in our cervical reflexes along with the eyes. And pay attention. Once you get it just activated enough so that you know that it's there, I want you to look at it. That's going to be direct. Look right at it. And then look the total opposite way. And look right at it. And then the total opposite way. Until it diminishes, or you feel the movement become more even. So you got a client, and they're got some pain in their shoulder, for example. You can use the palpation to find the tender spot, activate it just enough so the person has an awareness. And then you can now move into an intervention. Now we're into an intervention, which is we're going to try to shift it. And I can move in a circle with my eyes and identify where it makes it worse and where it makes it better. And just hang out in those two spots. Felt that one go. Just kind of feels like it dips out away from me. Or I can add another level to that, a little bit more aggressive, where I look at it and then totally look away. So the progression then for a spot, and that you find this that's sticky, all right? If you press into it, it's tender, but it doesn't have to be. I would, right on the tissue, start with just moving it into finding the ease, finding the bind, find the ease again, hold it at ease. Maybe I would turn the distal joint in a circle. Then the other way. then I might move it into bind and turn the distal joint in a circle. And the other way, and go back and forth between the two. And then if I can find a spot that is sensitive, my drag palpation, okay, I can use that, and I can move my eyes around to see if I can find positional release, and back and forth. And I can add the cervical reflexes by looking at it and looking away. And you're just layering all these different things on it. Another mechanism of positional release that is, again, one step more aggressive is you find the area. We're working off of a tender point or a sticky spot at this point. And now we're gonna see if we can find a monitoring point, and we're gonna move other parts of our body. So I'm gonna move my wrist until I find it diminishes. There. And then I might move my elbow or my shoulder. And then we also know that in general there is a cross-linking mechanism, so that our left leg pairs with our right shoulder and our right leg pairs with our left shoulder. So maybe I would change the position of my other leg and see if I can notice a difference. There. So you start layering the nervous system sensations with it.